Hi, good afternoon, everyone, and thank you for making time to join this session. The reason we're doing it is because we see just too many people with kidney disease, and unfortunately, the kidney is a vital organ. Fortunately, it's a vital organ, but when it starts to get destroyed and deteriorate, there's nothing much that even the medical world can do. So how can we prevent that from happening? How can we look after our organs? Why do our kidneys turn bad? Why do they start getting weak in performance? So we've spoken over the last couple of weeks, we've spoken about cardiovascular health, we've done the liver. Today, we're going to talk about the kidney. So we need to understand that, the human body has an ability to heal itself. But sometimes when we put too much of pressure and too much of burden on it, there's nothing much that the body can do. It can fight, and after a while, it kind of gives up. So today, we're going to go over a couple of things, which are risk factors. So the whole idea of preventive medicine is to identify risk factors that you may have so that you can take corrective action. So number one, we have two kidneys. What's the function of the kidneys? To expel waste from the blood. We know that when we breathe in oxygen, it reaches all of our cells. Carbon dioxide comes out as waste. We break down food. There's waste. We break down protein, carbs, fat. There's waste that has to be expelled from the human body. So it expels the waste from the blood into the urine and we pass it out of our system. So think of your kidneys as little filters, okay? Now, what happens if your home water filter stops working, okay? So the water passes through, it's not getting filtered, so there are sediments, buildup of mud particles, or possible germs, pathogens. They don't get filtered because the filter isn't working. All these toxins accumulate, and after that, they start weighing down on the filter, and then they jam the filter, and the filter no longer works, so the function starts to decrease. That's when we start to have kidney problems. The beauty of our kidneys, they give us several indicators all the time, to tell us how well the kidneys are functioning. And we're going to go over some of those things today. So besides expelling toxins, the kidneys also have a very important function of maintaining hydration levels in the human body, maintaining water, maintaining mineral balance, electrolytes. So like potassium, chloride, sodium, all our body salts. So, when you sweat too much, if you don't replenish with water and salts, like you're running a marathon, you can faint. You can have a cardiac arrest, okay, because the heart doesn't have sufficient amount of potassium, which is an electrolyte that's required for the heart function. So the kidney manages all of these electrolytes in a beautiful way. You're constantly constipated, so not constipated, you have diarrhea. You're passing out motion after motion, a lot of water. You start to get dehydrated. Your doctor tells you to take electrolytes, and put it in a liter of water and sip on it. That's so that your kidneys can manage your electrolyte function and your energy can rebuild because you're losing it through your stool. So it maintains that. Vitamin D3, yes, the kidneys has a role in the production of vitamin D3 as well. So sometimes in certain patients, no matter how much of vitamin D3 they're taking, they're getting sunlight, but their D3 levels don't come up. You need to check their kidneys. The kidneys have a role in vitamin D3 production, your red blood cell production as well. Your red blood cells are extremely important. Production of hemoglobin to carry oxygen from the air that we breathe to trillions of cells. And it also plays a role in the hormones, in the production of hormones that regulate your blood pressure. So now one of the biggest risk factors for your kidney is high blood pressure, which is why we constantly tell people it is not okay to live with high blood pressure. And if you have it, make sure that you're working with your doctors to be on the pill to manage it. Because even the slightest spike of blood pressure, let's say going from a systolic of 120 to 200, even if it's for a couple of minutes, is enough to cause damage to the blood vessels in the heart, other organs, the nephrons of the kidney, the blood vessels that supply blood to the kidneys. If the kidneys can't get the right amount of blood, you have damage. Okay, the kidneys begin to deteriorate. So high blood pressure is one of the biggest risk factors for kidney problems. Now, a lot of people maintain their blood pressure either with medication or lifestyle. That's brilliant. Some people have it hereditary in the family and you can't do it. You need to be on the pill, but also change your lifestyle, because if you are constantly getting angry and stressed out and you feel out of control, your BP responds that way. If you're constantly in the sympathetic nervous system, which is the fight and flight, your blood pressure is meant to be high. But in an ideal situation, the stressor comes down and your blood pressure should come down. But because we're constantly stressed and we move from one thing to another, it stays high and it causes damage to us. So high blood pressure. The second, diabetes. Diabetes is a massive risk factor for kidney disease, chronic kidney disease. We have to be careful of that. That's why we tell people it is not okay to live with diabetes as well. reverse your type 2 diabetes. It is possible to do that. We've done several videos, so you can go and check out those videos later. And if you cannot reverse your type 2 diabetes, at least work with your doctors to be on the right medication so that your blood sugar levels don't go out of control. Because every time your blood sugar levels go too high, there's damage being created. Now, coming to the third risk factor, which is a combination of high blood pressure and diabetes. That's a cocktail for disaster. I don't mean to scare you. I'm hoping that what I tell you motivates you to make some lifestyle changes. If you have diabetes and high blood pressure, it simply means that you are living the wrong lifestyle and you got to make the changes. Okay, most people will say, okay, let me take a pill for high blood pressure and let me take a pill for diabetes. And now I'm okay. You're not okay. You're still not okay. You still got to look at bringing down your blood sugar levels by changing your lifestyle, bringing down your high blood pressure by changing your lifestyle. Remember, having diabetes and high blood pressure together is one of the largest risk factors for your chronic kidney disease. So you want to take care of that. Now, what are some of the signs that we have? We're going to go over some of the signs as well. If you suddenly start finding you have a lot of fluid buildup, you're retaining a lot of water, especially in your feet. The feet tend to get swollen. Your fingers, you start bloating up, you start to have edemas. You find that there's a hardness in your abdomen area. It's a good thing to go to your doctor. Your doctor may order you to get a a kidney test done, which I'll share with you. Sometimes they may put you through an ultrasound as well, because that's a sign of water retention. Again, remember the filter, if the filter isn't working the right way, it can't filter. Filters have to pass water through, okay? Expel the waste, pass water through. So that brings us to another risk factor. If you find that urination is constantly painful, of course, if you have a urinary tract infection, that could be the symptom. But other than that, if you find that urination is constantly painful, or when you start the process of urination, it takes a lot of time or it's painful, you may want to get your kidneys checked, okay? Smoking, massive risk factor. Smoking is not just the lungs, it's not just lung disorders and lung cancer. In fact, our highest rate of bladder cancers are also related to smokers and tobacco chewers. Now, the bladder is connected to the kidney. Okay, when you expel, we understood at the beginning of this video that the function of the kidney is to remove toxins from the blood and expel it through the urine. That has to go through your bladder and then passes out of your system. So the bladder and the kidney. You see, you can't just look at the kidneys and kidney health. You also have to look at the liver on top, the bladder below. They're all interconnected with each other. If sometimes you have a problem with the bladder, you can possibly have a problem with the kidney. A lot of women and men who get constant urinary tract infections, like grade 2, which is accompanied by chills and a slight fever and pain in the kidney area, abdomen area. Now, you want to look at your kidney health as well, not just the urinary tract infection, not just the bladder. That's another risk factor. Binge drinking alcohol, no-brainer, massive risk factor again. You want to try to maintain a healthy weight. It all comes down again. Like I always keep saying, if you're pleasantly plump, you have a little bit of excess weight, try to lose it. If you can't lose it, it doesn't mean you're going to get a kidney disease, but make sure that you are always trying to reduce excess weight or fat from your body. That puts all of your organs in a better position to function at an optimal level. Salt. Most people are consuming more salt than required. 1 is in your food. 2 are hidden salts in your cookies and your chips and your fried foods and all of your hotel food. Remember, the best way to make food taste good is using oil, sugar, and salt. And that's what most of your packaged foods contain, which is why your kidney specialist, the first thing they would tell you is to monitor your salt intake. And sometimes when the kidney damages a lot, you may have to go on the lowest possible amount of salt. If this can be prevented because it changes the quality of your life, invest in prevention. Okay, don't eat excess salt. If you have a habit of constantly adding salt to your food and all of that stuff, it's a bad habit. Change it. It's okay. Your taste buds will get used to the food that you're eating, even if it has a little bit less of salt. Okay. Now, the kinds of salts, there's white salt, there's refined salt, there's pink salt. You have to have a mix of everything, because today, unfortunately, if you don't have the right amount of iodine, you can get thyroid problems, you can get goiter problems. At the same time, if you have too much of iodized salt. So we prefer that depending on your health, you have a mix of pink salt and you have a mix of white salt. That way you get the best of all, the white salt and the pink salt. Okay, the next risk factor, dehydration. Huge risk factor. Most of us don't give it importance. Oh, today I was low on water, no big deal. It was a big deal for your body. May not be for you, but every cell in the human body has been affected by even a 1% drop in your hydration levels. Starting off with your kidney, your liver, your heart, your brain, your reproductive system, every single organ and every single cell in the human body. So hydration is extremely important. At the same time, overhydration is bad for you. There are people who drink 6 to 7 liters of water because they think it's going to be good for them. Even athletes don't drink that much of water. So you need to understand, they drink more water when they train because they sweat that much. But too much of water, too much of hydration will also make you visit the loo too many times, pass out salts, minerals, and electrolytes. So you got to be very, very careful. Usually for most people, 8 to 12 glasses is usually sufficient for everyone. Now that can vary depending on how much you sweat, depending on your gut health, depending on your exercise schedule, and if you're on medication or on a warning from your doctor to keep your water intake at a particular restricted level. Like some patients cannot have more than 500 ml or a liter. So if you're given a restriction by a doctor, make sure you maintain that. Hydration is super important. The moment you start dehydrating, you are neglecting your kidneys. There is damage happening in the smallest ways, but surely. So watch for your hydration. Painkillers. I don't have a problem with people taking painkillers to do away with the pain when you need to. But if you are that kind of person that's constantly getting injured and popping painkillers because you still want to go and work out and you still don't want to take rest, let me tell you that NSAIDs, which are your non-steroidal anti-inflammatory painkillers, are damaging your kidney all of the time. And the sad part of it is most of these painkillers are available over the counter, OTCs. OTCs, I'm not going to take the names of them. You'll figure it out. All you need to do is Google the painkillers that damage my kidney and you will be shocked. Do not pop painkillers like candy. Take it only when you need it. And when you have to take it, make sure you hydrate, you eat well, you maintain your salt levels and all of that stuff, which we'll come to. So medications, there are many medications that have the side effects of damaging the kidney. So speak to your doctors. Whatever medication you take, you have the right to ask your doctor, what side effects will these medications take? Because if you know it's going to create damage to my kidney, you can take some preventive measures through your lifestyle, through your food, through your water levels, to working with your lifestyle to address the symptom faster so your doctor can reduce your medication. So medication is also something like how it damages the liver, damages the kidney as well. A sedentary lifestyle, huge risk factor for poor kidney health. So you want to make sure that you're working out, whether you're walking, dancing, doing yoga, but activity. Aim for 8,000 to 10,000 steps a day. That means you had an active day. Stress is a no-brainer. It damages every cell in the human body and every organ. And the worst part of stress for your kidneys is because stress will increase your blood pressure, and you saw blood pressure in turn destroys the kidney. So it's a vicious cycle. You've got to learn how to relax, take it easy, meditate, let go, accept, practice relaxation, practice acceptance, practice letting go. Because stress is a huge risk factor for kidney disease as well. Your diet, of course, the more refined oils you have, the more high cholesterol foods that you have. Remember, kidney stones also get formed. If you're overdoing it on calcium supplements, taking therapeutic dosages of calcium like 1,000 mg at a time, there are huge chances that you can form kidney stones. You have a poor lifestyle, you're forming kidney stones. Kidney stones damage your kidney. Sometimes when you have kidney stones, you get the same symptoms that we spoke about. It's better to get it detected by a doctor to see if you have kidney stones so that they can naturally try to flush it out of your system. If the stones are too big and it's creating other problems, they will remove it from you. But the point is, it is damaging your kidney, so you need to take corrective action. Your diet is everything. You want to eat your fruits, your vegetables, your nuts, your seeds, your legumes, your lentils. You cannot go wrong if you're eating a balanced diet. Now, of course, if you're a kidney patient, sometimes you can't have high potassium foods. Your dals and your legumes have to be washed in a particular way. So try not to reach the point of kidney problems where you have to change the quality of your life. Prevention is gold. Prevention is better than cure. We have to understand that. So we spoke about stones, urinary tract infections again. If you're constantly getting it, get your kidneys checked. Get your kidneys checked. Extremely important to know what's happening in your kidneys if you're constantly getting UTIs. It's also an indicator that you have a low immune system, so you may want to look at boosting your immune function. Genetics, you've got to be careful of that. A lot of children are born with high blood pressure, silent, and unfortunately they don't show symptoms and it starts to damage the kidney. So you want to make sure if you have a genetic history of kidney problems, polycystic kidney problems, kidney infections. If it's in your family history, get your children checked up right now before it's too late, because silent blood pressure can damage kidneys to a point that it's too late to do anything. So we need to understand about your genetics. Autoimmune disorders, things like lupus, systemic lupus can destroy the kidney function as well. So if there's a history of autoimmune conditions in your family, especially systemic lupus, you want to make sure that your kids or you get checked up for your kidney health at least once a year. Reports are good. Your doctor probably tells you to do a yearly check. If they find something in your kidney, then they may advise you to do other tests. You do your creat test. If your creat levels are high, your doctors will work aggressively with you to bring down your creat levels because they cause damage to the kidney. Number 2 is your BUN test, your blood urea nitrogen. That checks the amount of waste that you possibly have in your blood. It measures the amount of nitrogen, which is a breakdown of protein in your system. But sometimes don't worry if your BUN levels are high. If you're on antibiotics, it's automatic for your BUN levels to go high. So when you check your reports, never get worried. Show it to your doctor so he can correlate it with any medication that you may be on. Do you have your GFR? You want to check your eGFR levels because that tells you how well your kidneys are working as a filter. So if the function is great, you get a good eGFR, your filters are working absolutely fine. And in cases, especially like reoccurrent UTIs or kidney infections, your doctors will ask you to get a urine test. Okay, so all of these tests come usually as part of your basic complete blood count, your CBC, which you must be doing once a year to check what's happening in your body. If your reports are good, great. If there's an indicator, they may ask you a couple of questions and sort it out right then, or they may put you on to further testing. But remember, early detection is key. If you have a history of kidney cancer, you want to get your kidneys checked every single year to make sure there's no inflammation and destruction. Now, coming back to lifestyle diseases, like I said, most people suffering from CKD today, which is chronic kidney disease, are patients who have high blood pressure and diabetes. So over time, it begins to destroy the kidney. So what would you do? Start working with your type 2 diabetes and start working with your high blood pressure right now. Sleep, again, extremely important because every organ in the body heals and rejuvenates when the body's in a state of complete rest, which is deep sleep. So that is something else that you can look at. So it all comes down to lifestyle again. Prevention is all about your lifestyle, the foods, the exercise, the sleep, how you manage your stress levels. And of course, if you have any kidney problems, please make sure that besides the medication you take, you are also changing your lifestyle. It's very, very important to understand that because you want to remove the burden of your kidneys. Medicines treat the symptoms. Lifestyle helps you address the root cause of the problem. If you can reduce the blood pressure of a kidney patient even by 10 points, that is a massive win for the kidney. If you can stabilize the blood sugar levels in a diabetic who has chronic kidney disease, it is extremely important to understand that it is a massive win for the kidney again. Dialysis happens for a lot of people where the kidney can no longer function. So your dialysis machine is nothing but an artificial kidney working for you to filter out your waste. By all means, you want to try to avoid that as far as possible, getting to the stage of dialysis, which means your kidneys have started failing. Okay, so don't get worried about these things. Look out for indicators. There are always indicators. If you listen to your body is constantly telling you what is wrong. The same way you check to see that your car is working, your business is working the right way, your budgets are all in place. You have to keep track of your body. What is my body trying to tell me? Why am I retaining water all the time? Why do I have a hormonal imbalance all the time? Okay. You have to ask yourself these questions. Sometimes if you suddenly diagnosed with high blood pressure, never had it before, check your kidneys as well again, because it works both ways. You can have kidney function issues, and that can also cause your blood pressure to go high. All of these things are treatable, but prevention is better than cure. Thank you so much for your time. Make these little lifestyle changes. Everyone who's been commenting my prevention videos will now understand that there's a commonality between all of them. It's simple lifestyle. Eat clean, healthy foods that suit you. Give yourself some amount of activity every day. Give yourself the right quality of sleep and learn to relax. Stress is the #1 cause of all our medical problems. Learn how to relax. These are the 4 common pillars that will be common across every angle of looking at prevention. Have a great evening, everyone.